Hi there. Apologies for the time delay. Just we had a few technical problems. I'm William Quang. I'm the Adelaide heel pain guy that people know, and I'm here with our brilliant team, or some of our brilliant expert heel pain assessors. We've got Gemma here.
Hi.
We've got Jason, and we've got Bridget.
Hi.
So the topic for today is what are the 6 most common injuries or conditions outside of plantar fasciitis. Now, lots of patients go and they see a GP, a physio, a podiatrist, and they're told that they've got plantar fasciitis. They have some treatment and they're not fixed. Now, a large reason for that is because it probably is plantar fasciitis. So we're going to talk a bit today about the 6 most common conditions which are plantar fasciitis that we see in our clinic. So just with introductions again, we'll just start off here to my left here. We've got Gemma.
Hi, I'm Gemma. I'm originally from Melbourne, graduated from La Trobe University.
And on the other side of at the other clinic, we've got...
Yep, so it's Jason. I study here locally at Uni SA.
And I'm Bridget. I'm from Sydney, and I went to Western Sydney University.
All right, great. So let's start off with our 6 most common injuries. Gemma, do you want to?
So the first most commonly diagnosed one would be plantar fasciosis. While it sounds quite similar to plantar fasciitis, it's actually the same ligament that's involved, but it's a much larger area overall that it covers on that heel, and it generally involves a lot around the heel. So like I said, sometimes it can be a little bit more difficult to treat just because that scar tissue has started to set in a little bit more. But it's probably the most common cause that we see here and get some really great outcomes as well.
All right, great. Now, that would probably be our most common injury, I'd say. Would you all agree that we actually see more plantar fasciosis than plantar fasciitis in our clinic?
Yeah, absolutely.
Definitely.
I reckon it's 5 or 10 times more. So, yeah, plantar fasciitis, we actually don't see that often. We actually see the more sinister worst case. So, yeah, that's probably our number 1 most common injury at our clinic. All right, what would be number 2, Jason?
The second most common condition that we would see is Achilles tendinosis. So if I just got the foot model here, the Achilles tendon attaches to the back of the heel bone. So often that can be strained from recent increase of activity, but can also become quite chronic. And that's where there's a bit of degeneration, weakening in the Achilles tendon, and that's where it can be quite sore.
Yeah, it's a very similar sort of story as the plantar fasciitis. Usually pain first thing in the morning. It's usually quite stiff, probably a bit sore at the end of the day as well. So very similar, but just in a completely different location. Yeah, so all right, Bridget, what would be our 3rd most common injury?
Our 3rd most common, and often our most common in adolescents that we get, is something called Sever's condition. So this is like the child version of Achilles tendinosis or tendonitis, where we have that pulling along the growth plate. The pain's usually right at the back of the heel, sort of in between where the Achilles is and where you get usually plantar heel pain. And it's typically in really sporty kids. So we see it a lot in netball, soccer, basketball. They're usually sort of limping and quite sore by halftime.
Yeah, and you've got that sports shoe background, so you probably attest that a lot of them are from kids wearing those bad soccer and footy boots.
Yeah.
Yeah. All right. We're up to number 4 now. Gemma, what's number 4?
So it'd be plantar fat pad atrophy. So basically degeneration of the fat pad and that loss of that fat pad. We find it's most common in elderly patients or those really active patients that have had multiple cortisone injections as well. A lot of has been seen the degenerating down that fat pad.
Yeah, so you can sort of see, Bridget just mentioned all those 9 to 15-year-old kids. On the other end of the spectrum, we've got the more elderly people having the fat pad thinning out. Also, we do find that a lot of people get that because they've had cortisone injections. So, yeah, we do both ends of the scale with the heel pain as well in terms of the age. All right, Jason, you probably number 5. We were talking about this earlier. This is the most complex one.
Yeah, number 5 is a couple of nerve entrapment or compression injuries around the heel. So if I get the foot model out here, sometimes you can get on the inside of the ankle, the posterior tibial nerve can get compressed. Alternatively, there can also be the Baxter nerve, commonly referred to, which passes through that same area, but is a little bit lower down towards the heel, underneath the heel. Typically, the pain can be a little bit more on the outside of the heel as well, and that's caused often by compression between the abductor hallucis and the quadratus plantar. So a couple of muscles underneath the sole of the foot that can compress it and lead to sometimes a bit of a burning sensation, but similar symptoms to plantar fasciitis or plantar fasciosis. So it's a bit of a trickier one. And it can also linger on a little bit longer. So if you're noticing you're getting some pain maybe even after you stop walking, so at night time while you're resting, that might be a sign that you've got a Baxter nerve or tarsal tunnel nerve compression.
All right. Yeah, so that's, as I said, the most complex one, and a lot of them do end up being surgical cases. So we're in discussion with a few of the Adelaide surgeons here to maybe find someone who can really address those ones, because here at the Adelaide Heel Pain Clinic, we probably fix about 90% of the patients conservatively. There's just that 10%, and we do actually think, although there's probably about 3 or 4 dozen different diagnoses for heel pain, we do feel that most of that 10% is usually nerve injuries. Last one is actually a bone injury.
Yeah, so a little bit less common, we have what's called a calcaneal stress fracture. Calcaneal just means heel bone, and it's sort of most common in people that tend to walk quite heavy, so think military and defence personnel. This is where we have a repetitive trauma to that heel bone. So ways that we can test for that is just by squeezing the inside and the outside of the heel or putting some vibration right on the sore point, and that should elicit some pain in those sort of patients.
Great. So as I said, they're the 6 there. So you've got your plantar fasciosis, you've got your Achilles tendinosis, severs, what was yours? Fat pad injury, nerve injuries, and lastly, the stress fracture to the heel bone. So you can see it actually affects all different structures in the feet, whether it be nerves, bone, soft tissue, growth plates. So it is quite a complex area, the heel. And just off the top of my head, I can probably name 5. I can name 5 other injuries. We've got your retrocalcaneal bursitis. We've got tibialis posterior tendinitis. We've got rheumatoid or psoriatic arthritis. We've also got radicular apathy of the S1 and L5 nerves, which is another nerve injury that actually comes from the lower back. So a lot of lower back injuries can go down to the heel as well. So it is a very, very complex area, and it isn't just one thing that could be it, which is overdiagnosed with plantar fasciitis. We do find it, for example, with plantar fasciitis, it is actually overdiagnosed, particularly on ultrasound. Fasciosis. All right, so thanks for watching in, everyone. We're the Adelaide Heel Pain Clinic. We've met 3 of our practitioners here, and we will see you next. Or I will actually see you in about 2 days. I'm actually going to talk about the 3rd condition, which Bridget brought up, the severs injury, and with Nisha Gann, who's one of Sydney's top paediatric physiotherapists. All right, you have a great one. We'll see you in 2 days. Bye.
See ya.